All right, thank you for that, and thank you for the opportunity to speak today. As Mike said, I'm an infectious disease epidemiologist and mathematical modeler, and over the course of the pandemic, as you can imagine, I've been pretty busy working behind the scenes to help understand the spread and guide COVID-19 control measures. Many of you in UHealth may have seen my work presented on the clinical live streams calls last year by other people, or you might have seen me presenting earlier this year on what prospects we might have for herd immunity. But today I'm excited to introduce you to who I am, how I got to become an infectious disease modeler, and take you a little bit behind the scenes on some of the COVID-19 work that I've done over the course of the pandemic. So unlike most people in medicine, I didn't get into it because I had a formative experience with the medical system as a child. In fact, I really didn't try to get into it at all. I sort of stumbled into it on accident. I was born and raised in North Central Florida, where my dad is a professor of Caribbean archaeology at the University of Florida. So as a child, I spent my time between Florida and the Caribbean, helping out at my dad's archaeological digs until I got bored, and then my mom would take me and my siblings to the beach to swim in the ocean and snorkel in the tide pools. So if you asked me what I wanted to be when I grew up, ever since I was 3 years old, I would have told you I wanted to be a marine biologist. In high school, I got the opportunity to begin doing marine biology research with a professor at the University of Miami, Dr. Kathleen Sullivan-Seeley. With Kathleen and her grad student Kate, I helped to deploy certain species of coral around reefs to monitor how shorefront development and climate change were impacting the health of these coral reefs. And as I was getting ready to go to college, I asked Kathleen, what do I need to do to be successful as a marine biologist? And Kathleen told me some really surprising advice. She said, take as many math classes as you possibly can because you need math to understand biology. So when I started at the University of Florida that fall, I set out to live that advice. I double majored in math and zoology. And looking back on it, I'm actually pretty certain she meant take stats classes because statistics is way more useful in understanding data. But I followed her advice to a T. So in my freshman year, I began doing horseshoe crab research, studying sexual selection and life history. And as my coursework carried on, I realized that I wanted to figure out a way to merge my two majors into one career. I was doing applied ecology and theoretical math, and what I wanted to do was theoretical ecology or applied math. And so in my junior year, I set out to apply for RU programs and was accepted to one in the North Carolina State University biomathematics department. I didn't really know what biomath was, but I figured it was what I was looking for. So that summer, I was assigned to the epidemiology group with Dr. Alan Lloyd, and I had absolutely no interest in epidemiology whatsoever. I didn't want to go into medicine, but I figured I would learn a lot, I would figure out what biomath was all about, and then I would go back to campus and go back to my previous plan. So during that summer, something really interesting happened, as you can imagine, since I'm standing here today. It was actually the beginning of the last global pandemic. It was May of 2009. So in that summer, we spent the time scraping data off of public health websites and building a model of how pandemic flu was spreading across the state of Wisconsin. So that summer completely changed the course of my career, and as a result, I decided to go into infectious disease modeling. So for that, I went on to do a PhD in theoretical ecology at McMaster University, studying the factors that make malaria difficult to control. After that, I did a postdoctoral fellowship at the Johns Hopkins Bloomberg School of Public Health, where for the majority of my program, I was developing models and building forecasts of dengue hemorrhagic fever across Thailand to inform the Thai Ministry of Public Health for large outbreak years. In addition to that, I also worked on emerging and re-emerging infectious disease outbreaks, such as the Zika epidemic in 2016, and the largest outbreak of diphtheria in the 21st century in the Rohingya refugee population in 2018. When it came time to find a faculty home, I wanted to find someplace that balanced my desire to be at a top-tier research institute with my love of the outdoors and mountains. And with that, I found the University of Utah in Salt Lake. The Division of Epidemiology here has a robust program in infectious disease epidemiology and modeling, and as we all know, Salt Lake has unparalleled access to the Wasatch Mountains. So this is me climbing and skiing in Little Cottonwood Canyon in almost exactly the same spot during the pandemic, actually. So almost exactly a year after I started, so did the pandemic. Over the last 2 years, I've been working in close collaboration with local, state, and federal decision makers to develop models to understand how COVID is spreading and how we can control it. Throughout this time, the majority of my work, as I mentioned earlier, has been behind the scenes, but it's led to a number of key policy decisions, some of which I'll go into more, but others of which include advising multiple states, including Utah, Louisiana, California, and Maine, and serving as the external lead for the CDC's working group on COVID-19 in healthcare systems. One of the first things I began doing as the pandemic emerged back in February of 2020 is to develop a model with my colleagues at Johns Hopkins to project the course of the outbreak. One of the first questions that emerged was, how bad is this going to be? How many people are going to be infected? When is this going to be over? And so I built this model to understand the different disease outcomes, to project number of beds needed in the hospital and the ICU, and additionally to layer on top of that different interventions so that policymakers could compare and contrast what they might want to do. So this model has been used by numerous public health agencies to make a lot of key decisions, including the state of Utah, to scale up comprehensive testing and isolating back in March of 2020. Shortly after that, it became clear that as patients were being discharged from the hospital after being in the hospital for COVID-19, they were requiring additional care, but might still be infected with SARS-CoV-2. So in collaboration with Dr. Michelle Hoffman, who's now Deputy Director at the Utah Department of Health, I built a model to extend traditional epidemiologic models to project the number of beds that people would need in different types of long-term care facilities. This work was then used back in April of 2020 to stand up the first COVID-specific long-term care facility here in Salt Lake City. Since then, I've been working to understand how the vaccine effectiveness has been changing in the face of emerging variants. So back in July of 2021, I started to notice that there were a lot more breakthrough infections than you would have expected with a 90% effective vaccine. So with some of my colleagues, I deployed a field evaluation method to evaluate how the vaccine effectiveness was changing in the face of these variants. This work was recently highlighted in the CDC's COVID-19 science update back in August of this year. Going forward, I, like everyone else, am really excited to see the pandemic in the rearview mirror. However, I'm really hopeful to capitalize on the momentum that's been generated over the course of the pandemic to begin tackling other pathogenic threats. The first of which will be to work on the K01 that I was recently awarded by the NIH to understand how healthcare-associated infections are spreading in hospitals. For this work, I will be integrating genomic and epidemiologic data to build better models to identify who infected whom in a healthcare setting, and hopefully be able to provide some insight to how to better control these pathogens. And hopefully very soon, I'll be able to work on this without the looming threat of the pandemic lingering over my head. And so with that, I would like to thank all of the people who helped get me where I am today, as well as all of the people who helped contribute to this work and all of the funders. So thank you.